All right, we got Mr. Sweet here. He came in with hyperglycemia. His blood sugar was 304 milligrams a deciliter, and his A1C was 12.3. And I got orders here, discharge instructions to help him better manage his type 2 diabetes. First, Mr. Sweet, I'm going to ask you what all you know and understand about monitoring your blood sugar at home and why we need to keep an eye on your blood sugar and keep a record of it. And I let Mr. Sweet answer, and I'll tell him why he needs to keep a documentation of his blood sugar at home. And you want to self-monitor your blood glucose levels at home so we can assess the effectiveness of the treatment for your type 2 diabetes, how much insulin you're taking, when to take it, so on and so forth. And you want to keep a record of your blood sugars that you take. That way we know how effective the treatment is. And you have orders to take your blood glucose fasting, and that is 8 hours with no caloric intake. You can't have water. That's about it, Mr. Sweet. I know, it's tough. And we want to try to keep that less than 100 milligrams a deciliter. That's normal. You're also supposed to take your blood glucose levels before your meals 3 times a day. You want to take your insulin Lispro about 10 minutes before a meal. And we want that to be between 70 milligrams a deciliter and 130. You can take your blood glucose again post-meal about 2 hours afterwards. The normal range for that will be less than 180 milligrams a deciliter. You also have orders here to take your blood glucose before bedtime as well, Mr. Sweet. Blood glucose fasting before meals and at bedtime. So, what all do you know about hypoglycemia and hyperglycemia? I know you came in with hyperglycemia. What is your knowledge and understanding of those two? Okay, well, for one thing, we want to make sure we keep a record of our blood glucose. That way we don't become hypoglycemic or hyperglycemic, right? All right, well, first of all, hypoglycemia is when your blood sugar decreases below 70 milligrams a deciliter. Some signs and symptoms of hypoglycemia, what you need to be looking out for is cool, clammy skin, you become anxious, kind of nervous, maybe a little bit of confusion, weakness, double vision, blurry vision, could be tachycardia, a little fast heart rhythm, and some palpitations. Once this happens, you start getting signs and symptoms of this, Mr. Sweet. You start getting hungry, maybe a little shaky. You want to treat with 10 to 15 grams of carbohydrates. All right. Example of that would be like a half a cup of fruit juice, 3 graham crackers. You want to repeat your blood glucose 15 minutes after you eat those carbohydrates. If it's still low, repeat that again. Go ahead and have you about 10 to 15 more grams of carbohydrates and recheck your blood glucose. It may take a little bit for those carbs to kick in, get your blood glucose levels up. All right. For a little bit more, you know, if it's less than 40 milligrams a deciliter, a little moderate case of hypoglycemia, eat 15 to 30 carbs. Then test your blood glucose in 15 minutes as well. Eat another 15 to 30 grams of carbs. For severe hypoglycemia, we're talking about you becoming unconscious, stuff like that, unresponsive. We're going to have to notify the healthcare provider immediately and wait for his or her instructions on what to do next. You may have to come into the ER if it gets that severe, Mr. Sweet. Hypoglycemia is nothing to mess around about. So prevention of your hypoglycemia, we're going to correctively time your meals. You want to make sure that as soon as you take your insulin, within 10 minutes, you're eating your meals. You're getting your 3 meals a day. You're counting your carbohydrates. You're not eating too much, too less. And if you're going to exercise, we want to make sure that we want to take our insulin and exercise when it peaks. We want our blood glucose to be around 80 milligrams a deciliter and less than 250. So We want to make sure we time that right. And let's not have too much insulin. So if you lose a lot of weight, we need to make sure that we check what you're taking and reevaluate. That way you're not getting too much insulin. So hyperglycemia is when your blood glucose levels reach above 250 milligrams a deciliter. This is pretty serious stuff here. You could go into diabetic ketoacidosis. Could get very serious. Signs and symptoms of that: warm, moist skin, dehydration. We're having our rapid, deep respirations, the Kussmaul respirations. We have a fruity odor to our breath, all that acetone. A mental status, we could be alert, anywhere to unresponsive to almost coma-like. Abdominal cramping, nausea and vomiting, orthostatic hypotension, tachycardia, fast heart rhythm, poor skin turgor, could have positive ketones in the urine. It's very bad. So treatment, exercise. Exercise will help keep your blood sugar levels lower. Good healthy diet. Once again, we want to make sure that we keep those meals 3 times a day, insulin in the correct time, and check our blood sugar. We want to make sure we have enough fluid intake, at least 2 liters a day. 3 would be nice. Can we get 3 out of you? All right, Mr. Sweet, that sounds good to me. We want to make sure we ingest at least 150 grams of carbs a day. Diet's huge. Electrolyte replacement, drinking your Gatorade. Take our insulin as prescribed. Glucose checks. Eating less, counting our carbs. If it gets real serious to the ketoacidosis, that's when we get you here in the ER. We're going to have to give you IV fluids, insulin, and electrolytes, and cardiac monitoring. All right, so your orders are insulin Lispro, 5 units sub-Q, 10 minutes before meals, 3 times a day. Insulin Glargine, 10 units sub-Q at bedtime. So for our injections, our sub-Q injections, our sites are our abdomen, 2 inches away from the umbilicus, below the costal margins, and above the iliac crest. We have the outer aspect of our upper arm, and we have the anterior middle third of our thigh. So 1, 2, 3. This is our middle third of our anterior thigh, and that's our 3 injection sites. We want to use a insulin syringe because the measurement is in units. We want to use a 25 to 29 gauge needle, 3/8 to 5/8 inches in length, and 45 to 90 degrees is our injection. If we pinch 1 inch, 45 degrees. We pinch more than an inch, it's 90. So that is our injection sites. And I'm going to go ahead and demonstrate to you how to give a insulin injection here, and then you can show me, have a little teach back. So first I perform hand hygiene. Put my gloves on here. Gonna take our alcohol swab and clean the top of our vial here. We're gonna go ahead and drop 5 units here. I'm going to drop 5 units. Get close, Mr. Sweet, though, where you can see how this is going down here. Alright, that's 5 units. Make sure we get those bubbles out. We don't want no bubbles. Good. All right. So now, let's say we're going to give the injection on the abdomen, 2 inches away from the umbilicus. We'll clean our site. We got about 2 inches here. Stabilize, 2 inches. I'm going to go in 90, straight in. Inject. Pull out. Safety first. All right, just like that, Mr. Sweet. And so for disposal of your needles are a one-time use. You don't want to use it twice. So we discard after every use, and this needle disposable can be obtained at www.safeneedledisposal.org. I think the closest place you can go to dispose your needles are Massac County Sheriff's Office for needle disposal. And that is how it's done, Mr. Sweet. And that's when I would ask Mr. Sweet to give me a teach back, show me how it's done, and we make sure Mr. Sweet can administer his insulin properly. Do you understand everything that I've told you, Mr. Sweet? Do you have any questions? Anything of that nature? All right, Mr. Sweet, I appreciate your cooperation, and you have a follow-up with our healthcare provider in 7 days, and you should have the number on the orders, and let us know if you have any questions.